I was walking at the George Leach.
I woke up in bed at about 12:30 in the morning.
It felt like somebody was draining all of the energy out of my toes.
I just felt pain right between my shoulder blades and my chest bone here, like right in the center of my chest.
I got this funny feeling down my arm. It continued until I stopped, and I knew there was something wrong.
So I drove myself to the hospital.
Well, this is the Cath Lab, so this is I guess the place of action for the cardiology programs.
You know, people come in for a number of reasons. They're short of breath. They've had some funny chest pain, back pain.
Sometimes they've walked in off the street and had no idea this was going on, aside from a few symptoms.
So they come in here, we take a look at the coronary vessels.
The procedure itself can take anywhere from 15 to 20 minutes.
Before the first week in August, they were sent away if they needed some sort of intervention, both bypass or stenting.
We would see a lot of cardiac patients who really didn't have timely access to cardiac care.
It was really stressing me out just sitting here in the SU, knowing that time was ticking and you know, I was worried that something worse was going to happen with my heart.
It became apparent that we needed to bring these types of services closer to home.
We've needed this for a really long time. I mean, if you look at the entire province, we have people with the highest number of risk factors for heart disease.
When it was made aware that there was a critical need for people to come up, we were approached at St. Michael's Hospital whether we would like to come up and service the area as well.
The expertise that the St. Michael's group has brought to our community is exceptional. These are world-class leaders in terms of the quality of care they provide.
We now offer an extra service. We offer the treatment we're not just looking for things, but we're fixing the problem also.
Like that first stent we put in our Cath Lab, you know, at Surya Hospital, that has totally changed our program. We
have patients, you know, that first off, from a medical standpoint, to receive their care here means that it's the difference between life and death, literally. So you could say that this is where we actually save lives.
I could say one of the most memorable was the second or third day that we started the angioplasty program up here. I was up here, and we had a very young man who had a big anterior myocardial infarction, so a big heart attack.
I had 100% blockage.
If we didn't do him right away, he would have went on to have another heart attack.
Before, if he had had that a week earlier, he would have suffered a lot of heart damage, would have been transferred to another center like St. Mike.
And we talked about it as a team and with the physician, you know, to make sure everybody was comfortable. And we just said, yeah, let's do it. Like, it could be our husband, our brother, you know, anybody. He's somebody's son, somebody's husband. Like, let's get this guy up here and save as much muscle that we can.
I'm almost back to normal. 99% of the time, I feel better than I ever did.
I actually saw him in follow-up in clinic just on Tuesday, and he was there with his wife, and he was so happy and so appreciative, and he really recognized that how important doing what we're doing here, how it made such a big difference in his care.
And it's stories like that, you know, that really make it, we know we've done the right thing in getting this program here.
I think we're on track for about 300 people, and that's 300 people that, you know, won't have to travel. Maybe 5 to 10 of them will have to travel now, where, you know, 300 would have to before.
I've experienced both, being away and here in the SU, and the procedure in the SU was altogether different. The people were they were wonderful. They made me feel very, very comfortable. My daughter and my son were here with me. It was really a good experience.
And I think that's all part of good clinical care, is being in an environment where you feel comfortable and you feel the support of others around you is also very important for clinical care. The outcomes are better, we know that.
People don't have time to be sick, right? Let's face it. Nobody wants to be sick. Nobody has time to be sick. And so now we're taking one day of their life rather than perhaps 3 months.
Ultimately, our goal is to get 24/7.
You know, it's always easy to talk about a program in the abstract, about how it's developed and how it's changing lives and impacting others. But it's always important to remember why the program is and why it's successful and why we're able to do what we do. And it's only because of the generosity of donors.
This program wouldn't be the success it is today without the community support.
I've been a volunteer for 33 years. When we have any of the functions that we're raising the money, I always tell them that we're raising money for the cardiac care unit, so people don't have to fly to Toronto or Sudbury or anything. They have everything done right here.
You've actually made a difference. If that wouldn't have happened, none of our little tools and things would be here, and that father of 4 might not be here.
I'm glad there was people in the community to drive this program and get it going.
You've provided the gift of life to people, which not too many people are able to do that.
You've given a tremendous gift that will change the lives of people in the Soo and eventually further and further from the Soo forever.
Thank you from the bottom of my stented heart, and for our patients and my family members as well. Thank you for your generosity.